There have been activists calling for the protection of freedoms such as speech, expression and education, but not much is heard of activists fighting for Ugandans' right to health care. That right, however, has not been fully protected in Uganda's constitution. The Law Reform Commission is currently reviewing the laws to remove inconsistencies, so maybe this is the time to drag attention to the health sector to ensure that the right to health care is protected.
One law that could be targeted is the Public Health Act, a colonial piece of legislation which was adopted a long time ago and which has provisions that are not human rights friendly.
This survey, carried out in Soroti, Gulu, Masaka and Fort Portal, 4 out of the 13 regional referral hospitals in Uganda, shows that there is still a shortage of staff, resulting in delayed service delivery and subsequent death. Hospital staff live in terrible conditions, the hospitals are overcrowded, and while they do have most of the basic equipment, it is old.
While there is a will and commitment of the medical staff to work, we don't seem to see government in there. We met staff who had been on probation for 2 years, 3 years.
And there are more gaps, especially when looking at the mentally ill. The physical facilities for them are lacking in these hospitals.
Facilities are in a bad shape. They fall short of respecting the rights of the mentally ill, and sometimes not safe and secure for the health workers as well. So,
among other things, the report recommends that the government increases the health budget to cater for administrative, medical and development costs. Government should invest in the welfare of health workers, increase training of health workers, invest in better information management systems, adoption of clear and comprehensive guidelines for health centers. The research was carried out last year, and it is hoped that these findings will be used to advocate for a better healthcare system. Josephine Karunji Misisi, NTV.